Mills.
Hi guys, and welcome back to the ZEZE MILLS Show. I am ZEZE MILLS, and today we have a special episode. Well, all my episodes are special, but this is definitely a special one. Today we are going to be talking all things COVID. Now, I don't even need to explain what COVID is. Everyone knows what COVID is. But I think at the moment, everyone is not forgetting that COVID is here, but more or less we kind of are living our best lives at the moment. So today I have Dr. Gabi with me, and we are just going to have an open conversation about all things COVID, the vaccine, how we still can protect ourselves, if we still need to protect ourselves, because I think what's happening now is we were all in the thick of it, and we still are in the thick of it, but I don't know if everyone realizes that we're still in the thick of it. From what I gather anyway. Like, I went to a few festivals during summer, like even just going to restaurants now and stuff, it's a lot more easier. So talk to me, is COVID still as serious as it was at the beginning when all of this happened?
Yeah. Well, I think the question is, are we still in a pandemic?
Right.
And yes, we definitely are still in a pandemic. So there's still people all over the country getting COVID every single day, thousands of people, and all around the world, people are still getting COVID, so it's not over.
Do you think it will ever be over? Because, like I said, there seems to be like a light at the end of the tunnel. I remember when we was literally locked down, like in it, all of us were thinking, well, I actually remember the first day when they was like, okay, everyone, you're going to go home now, and we're going to all work from home. And I remember in our office, it was like, you know what, it'll probably be a week. We'll be back here in about 2 weeks' time. See you then. Like we were all so naive to the point where I was like, yeah, I got my job. I was made redundant because of COVID, as a lot of people were. And it's almost like I don't actually remember life properly, I don't think. Before COVID.
Yeah.
And so now I'm trying to think, what is life gonna be like? Is it ever gonna go back to normal? Is this just our new normal now?
I mean, I think humans are really good at adapting, right? So you're finding it difficult to remember what life was like before, and I'm finding it difficult too to remember what life was like without worrying about something invisible that you could catch that could, make you end up in hospital. Right. But I think the definition of over is important to clarify. Yeah. So does over mean zero COVID? I think that is very, very, very unlikely. It would be a miracle. If we look at countries like New Zealand that had like a zero COVID strategy, they haven't been successful in achieving that. They've done very well in having low infection rates and low numbers of deaths, but at the end of the day, it just takes one person to start a whole new pandemic as this one started. So it's unlikely that we'll get to a point where there is no COVID whatsoever. But what we do need to do is adapt as we've been doing and learn how we're going to live with this virus, how we can protect ourselves, protect our families, and stop people from ending up in hospital, stop hospitals from becoming overwhelmed, and stop people from sadly dying from this awful disease.
So I think, especially within the Black community, and also amongst young people as well, I feel like there's been a lot of miscommunication, whether that's because there wasn't enough information in the beginning. So and I think that's one thing that I've kind of been aware of and a little bit empathetic more than other people, because everyone's like, oh, they should know what they're doing. And in my head, I'm like, well, of course they don't know what we're doing, because it's a new thing. No one knows what's happening. And it's kind of just been trial and error. But I do remember at the beginning when this all happened is that young people, we were told that it didn't affect us really. And the reason why we needed to be, careful was because we didn't want to, infect the older generation, our grandparents, the vulnerable. And now it seems that at the moment, like even with the Delta variant, it's more to do with us young people, and the young people, we need to be more wary of it now, and it's affecting us. I've heard like so many stories of like young people that have gone into hospital, they've had problems with their heart, their breathing, and this is all because of COVID. So tell me, as young people, I like to refer to myself as young, so you know what I'm saying?
Young.
Yeah. As young people, what can we do to keep ourselves safe and to keep others around us, even though at the beginning we was told that it didn't really affect us?
Yeah. So I think for young people, you know, and I class myself as young too, we want to go out, we want to have a good time, we want to travel. You know, it's been 2 years that we've essentially put things on hold, and now it's time to sort of move on. But we need to do that in a safe way. And one of the safest things that we can do, we know it protects against getting COVID, we know it's really effective at protecting against death, is the COVID-19 vaccination program. We know that it really protects people. So to be going around, traveling, going to crowded places without that badge of protection, it is really taking an individual risk. But not only is it taking a risk with your own health, you are putting your loved ones and those around you at risk if you then bring COVID into their environment.
But this is the thing that confuses me about the messaging of, I understand about keeping yourself safe, and the vaccine is to help you fight it, you have more of a chance, etc. But what is the messaging? I don't understand the messaging about protecting others, because whether I'm fully vaccinated or not, I still can pass the virus on. Yeah. So what has me having the vaccine got to do with you?
If you have a household of people who are all vaccinated, it is much less likely that one of those individuals are going to bring COVID into that household. Okay. If you have a household where everyone is vaccinated and one person isn't, it's much more likely that that person is going to bring COVID into that household. And then there is a chance that the vaccinated people could then get it. Although it's a lower risk, it's still a risk. So, you know, people are trying their best to kind of move on. And if we have large numbers of people who are not sort of getting that badge of protection, we don't want to get a new strain that evades this vaccine. Like, this vaccine is our best shot at returning to a somewhat normal life, although it's not going to be exactly like things were before COVID existed.
So what about the people that, obviously this is speculation that we see on social media a lot, and just on the net, people that have the vaccine and still get really ill and then still unfortunately pass away. And I think that is what where there's the kind of, so what's the point? Especially as a young person who we were told in the beginning we didn't need to have it, and now it's like, okay, we want you to have this vaccine. And a lot of young people I think it's over 81% of young people have had the vaccine. So obviously there's a lot of us that are doing it, but I can't help but think, okay,
what's the point?
What is the point? What's the point?
There is a very good point and a very good reason why people should. So of the people who are passing away from COVID-19 since the vaccination program started, a very, very, very small minority of them are double vaccinated. I think it's something like 1%. Okay. So the vast majority of people who are in hospital, in ITU with COVID, are people who are not vaccinated or people who've only got one vaccine.
So do you think a lot of, how do we as people kind of slimline the information that we're getting? Because I saw a video the other day and it was like, the guy one doctor basically, there's so many now, the doctor, and he had said, I haven't taken the vaccine yet. But this was like an old video. Then someone put it up and was like, see, even he hasn't taken the vaccine. And then it was reported later that he had, obviously, like a week after that video, he had taken the vaccine. Yeah. So how do we like slimline our information? Because I do feel like there's a lot of misinformation on both sides maybe, where we don't understand now where to look, what information to believe, like where's the best places for us to go and look and kind of make up our own decisions on what we feel is best for us.
I mean, the information is changing all of the time, and you want to go somewhere where you know it's a reputable source of information, where they've looked at the evidence, not just in this country but in the whole world, and put it all together. So the NHS website is a really good place to kind of get your information from. It's where I get my information from, so anytime I'm giving out info to people, I usually go back to that website and check what's happening, because it's changing all of the time. Also, the UK government website is really good, and the World Health Organization website is pretty good as well at giving people up-to-date information.
Okay. Another thing that I think is that people are taking the vaccine for the wrong reasons. So I'm not against the vaccine. I think if you want to take it, you take it, whatever you feel is best for you. But I do feel, especially us young people, we are literally taking the vaccine so that we can get on a plane. the only time I hear people talk about the vaccine is like, I want to be able to fly. Day to day, you can take a negative COVID test. I can show it. I can show you my screenshot. Great. I can more or less live my day to day life without having it. But flying, and I think to me, that's where I have an issue with this whole thing, is that do what you feel is best for you. But I don't agree with now, almost it feels like we're being forced into taking the vaccine, like we don't have an option. And if we don't take the vaccine, then our lives is going to be kind of made difficult for us. Do you think that's right, that most young people, I think anyway, are just taking the vaccine for freedom, not because they actually believe that it's going to help?
Yeah. I mean, I think that it's important that people take individual choices about their health, okay? And they make an informed decision. So that means having all of the information about something, knowing all the benefits of and the risks, and then making a decision for yourself. And when it comes to health, that is important. It's your health, it's your body, it's your life. I mean, for me, there's a vaccine that I took without doing any research into it so that I could fly, which is the yellow fever vaccine. So on my lunch break, I whipped down to Boots, they jabbed me and I went back to work because the country I was going to had mandated that you need that vaccine. And to be honest, that was not a good thing for me to do. I should have researched.
But it's a good point though. It's definitely a good point, because even I made the argument in the beginning. I was saying, it's so funny that everyone's so like, oh, the vaccine, they're trying to poison us, they're trying to this. But we will literally go to so many, we don't even think twice. The doctor says, you need this to get into this country. And I'll be like, yep, inject. No one, do you know what I mean? But with this thing, everybody is very wary of it. I think where that also comes from is how quickly everything has happened as well. And so much information, you got to do this, you got to do that. And everyone's kind of like, so how did this come about so quickly? Can you kind of give us some insight into how it's come around so quickly?
I think people are skeptical because the virus spread so quickly when it initially became a thing. And then we've never really had any vaccine that has been made from start to finish this quickly. The fantastic thing though is that it has shown that we do have the capability of producing life-saving health policy interventions like this vaccine quickly if the whole world puts their mind together and if the whole world puts a lot of money towards it, because it's in the whole world's interest. So all of the different phases that are needed for vaccine development have been done for this vaccine. It's just that companies didn't have to beg for funding or investment between each phase. It was just done without having to wait years between each phase of a trial. So that's why it was done more quickly. And I want to see this being done with the same speed and urgency for other diseases.
Can you speak about some of your experiences with young people that have had COVID and just what you've seen, and kind of just talk about anyone that has these things of like, oh, it doesn't matter, it won't affect us, oh, I'm fine, I'm strong enough. Can you just maybe talk about some of the things that you've seen?
Yeah, so I mean, I have seen people who, young people who've been in ITU, which is intensive care unit, with COVID-19. They've, for some reason, had like so many clots all over their body. So it's not just one clot in their lungs, it's like many, many clots in their lungs needing an operation maybe to clear it, when usually we can just give people blood thinners. So we're seeing really unusual types of disease that we don't usually see in people who've had COVID-19. I've seen a lot of people who have long COVID, so that is something that is a very real risk for young people.
What's this long COVID?
Yeah, long
COVID.
What's that? So long COVID is something that encompasses a wide range of different symptoms. So what we were seeing as doctors is that people who've had COVID, some of them would go on to have breathlessness ages after the body has cleared the infection, some people having chest pain, some people having extreme tiredness, so they're not able to go to work even months after having COVID, some people having strange headaches, strange numbness or sensations in their body. I know people who've had like stomach problems after COVID, and some people, when they lose their sense of smell or taste, even after COVID has cleared, it doesn't come back. And when I had COVID, well, I thought I had COVID, but I couldn't get tested at the time, I had no smell or taste.
That's like me. I got COVID at the beginning, when the whole testing thing wasn't a thing. Yeah. So I lost my taste and my smell. Yeah. And I just remember thinking, oh my God, like this is so weird. Right. It's like the most weird thing. And then some of my friends, like you said, they they lost it for like a month. Mine came back pretty quickly, but they lost it for a month even after. And also the cough. The cough doesn't seem to go away either when you catch COVID.
I mean, everyone is different.
Yeah.
So I didn't have any cough. I just had the loss of smell or taste. And I did think, if this doesn't come back, I could eat things that have gone off. I want to enjoy my food. This is not great. But it did come back. But I have had patients where even like a year later, it has not come back. And now they're starting to have psychological impacts of that, because when they go out, they can't taste their food, and it's really difficult for them.
Yeah. What would you say people that, because obviously uni's going back to now, loads of young people are out and about, what are like the 3 or the top things that they can do? Shared accommodation, because obviously that must be quite hard. You can't control where everyone goes, but how can you kind of control what's going on in your environment? How can they be safe?
I think for people who haven't already been vaccinated, it's important that they do think about it, okay? And just go on the NHS website and maybe book in to go to a walk-in centre or book a vaccination slot.
Can you choose what vaccine you take?
So for young people, it's going to be one of the mRNA vaccines. So not to give people too much jargon, but you can't just have free choice of all the different ones. It's the ones that are safest for the different age ranges. So it's a good idea to book an appointment, because when you go there, you can actually speak to somebody face to face and go through your own health history, your own individual risk, and talk to them about the benefits and the risks. And most people do decide to get the vaccination, but if when you get there you change your mind or you want more time to think about it, that's fine as well. So that's one of the really important things that all young people can do. Okay, even people who are 16 and 17, it's encouraged now that they really do go to get vaccinated, because this country is behind others now when it comes to younger people. The other thing I would say as well is regular lateral flow testing. So it's so easy to get these tests. You can just pop into a pharmacy and just pick them up for free. And I think that's really fantastic that we don't have to pay for stuff like this in this country, and it's not like that everywhere else. So testing yourself twice a week, it's really easy to do. It's like a pregnancy test. You get results within 10-15 minutes, is very good, because some people do have COVID without any symptoms. So it just gives you that reassurance that you don't have any infection that you could be passing on to somebody else, especially if you're in contact with lots of different people like young people are. And the third thing I would say is masks. Okay, this is a very interesting topic. Some people are very pro-mask, some people are very anti-mask, and it's kind of become like an identity thing now, whether you're pro or anti-mask. But we do know that the evidence shows that wearing a mask does prevent someone who's got an infection from maybe giving it to somebody else. So when you're in crowded areas like public transport, we all make an effort to wear one. That is going to be better for the country, because it will help to protect people in that crowd. And simple things like washing your hands regularly, okay, is important to kind of, not just with COVID germs, but any other germs you can pick up when you're out. And trying to live a nature lifestyle, so doing more things outdoors. Even though it's winter time, all restaurants and bars have adapted now, so al fresco dining is a big thing. Now it's everywhere.
I know, right?
So if you can sit outside, then do that, because it's good to get fresh air, and also it's better ventilation.
Okay, and what about sex?
What about it?
Can you have sex? Because at one point they were telling us we wasn't allowed to have sex, we wasn't allowed to touch each other, no close contact. I even saw like a thing going around where there was like different COVID positions at one point that people were like, you do this because you're not breathing on each other. Is this all just like a myth, or is it?
Yeah.
Or should you not be breathing? Should I be holding my breath?
Yeah, as far as I'm aware, there are no instructions on what people choose to do when it comes to their personal life. But what I would say is, it's good to be selective,
Well, before, even without COVID, please be selective, guys. Like, chill out. Another thing as well that I think is a really big barrier when it comes to the vaccine is fertility. So a lot of, I put a question thing on my Insta today, I said questions, and most of them that came back was to do with fertility. You know, does it affect a woman's fertility? Has there been enough studies around that for us to know that it will be okay? Also, does it have effect on your periods? Somebody messaged me and said, you know, their periods have now become irregular. And I think that when I've been thinking about doing the vaccine, I haven't had children yet. I don't know, like, if it's going to be difficult for me to have children. You know, I've not had that process yet. So in my head, it's like, okay, do I want to do anything that could possibly make that harder for me? So talk to me about that.
I think that's definitely something that has crossed all women of childbearing ages' minds. And I don't know how this became a thing, because for me, when I reflect on it, all the other vaccines I've had in my lifetime, I never asked, is that going to affect my fertility? Am I going to be able to have children? So I don't know why with the COVID vaccine it became a thing. So I thought, of all the other vaccines that exist, do I know anyone who's ever had a fertility problem because of a vaccine? And the answer is no. And when they did the vaccine trials in America, there were a lot of women of childbearing age in that trial, and they told them, look guys, we don't really want you to get pregnant because this is a trial, so please don't get pregnant. And quite a lot of them still got pregnant, so they were having a good time during the trial, but they still got pregnant and they went on to have babies and they didn't have any problems. So there is no evidence to suggest that it affects fertility.
Do you think that people, it just all boils down to everything being just so brand new, and us not kind of not understanding COVID really, not understanding the effects or the long-term effects? Do you think that's where a lot of these things come from? And are there actually any scientific research that backs up any of these kind of speculations that people have?
The speculations, yeah. I mean, I have spent hours and hours, I've had sleepless nights. I was obsessed with COVID in the beginning, because I was looking at all of the publications from all over the world, publications in really good scientific magazines like The Lancet. And I haven't found anything substantial to support some of these claims that different people are making. I think because when this thing started, nobody really knew what was happening. Like, it was such a big unknown. Because people have been told different things historically, people are a little bit skeptical when listening to the guidance. Right. But the good thing is that, you know, the WHO and the government and the NHS, you know, we've really got our act together. Like, we really know what we're dealing with now. There are so many fantastic professionals who are working behind the scenes, going through all the data to sort of give the advice. And at the end of the day, the majority of countries in the world are really saying the same thing. So this is, you know, public health officials of all different nationalities, religions, backgrounds, ethnicities. We're all on the same page when it comes to the public health methods needed to kind of suppress this pandemic.
And what's some of the, you know, to like people that think, oh, I'll have it, I'll get over it, blah, blah, blah. What's some of the, you mentioned some of them before, but what's like the long-term effects of COVID? You know, some people are fortunate enough to just have it and then that's it. And then, like you said, some people have problems with breathing. I know some people that now they've got problems with their hearts, or something that had to be taken out of them just because of COVID. And it was a young person as well. They're not that much older than me. So it was weird for me to hear that, because I'm like, wow. And even people that I've spoken to that have been like, COVID, I don't believe it. I literally saw one of them the other day and they was just like, yo, COVID is real, boy. That thing tried to take me out. Like, I've heard so many young people say that, like, who were very skeptical in the beginning, like, nah, this ain't thing. Now they're like, yeah, that thing is real.
I think because it's invisible, and so if you don't see the consequences of it in real life, it can be difficult for it to be a real thing. So for me, I have, you know, I've seen the fear in people's faces when they can't breathe, and I can't imagine how that would feel to be trying to breathe and it's just not coming in. I've seen people look really grey and blue. They're not that old, and, you know, oxygen has saved their life. So to kind of take that risk where you don't know if you're someone who's going to have no symptoms, or you're just going to lose your smell or taste, or have fever, or have cough, or end up in hospital, end up intensive care unit, or have long-lasting changes in your body, that is not really a risk that I think is a good idea to take.
And before, it was very much emphasized that, you'd only be like critical for you if you had underlying health issues, where that's not really the case anymore, is it? Because we're seeing a lot more people that don't have it, or they didn't know they had. What is it that they don't know that they've got underlying health issues, or they actually just they haven't? Because I know a lot of people, it's once they get there, then they find out, oh, this is wrong with me. Or do they just not have it?
People who have underlying health conditions, it is a greater chance that they may end up in hospital. But at the moment, there's a substantial number of young people in hospital who have COVID, because there are more younger people in total getting COVID, and they may not all have underlying health conditions. So with sort of medicine and health, there's no guarantee. And when we think about risk, there's always going to be, if there is a small number of people who end up unlucky, that's a big thing for that small number of people. What
about the people, what do you say to the people that are like, oh, COVID is just flu? It's just a cold, everyone's, or they're blowing it out of proportion, because over 100,000 people have passed away from COVID. So when people look at that, they say, okay, we understand that people are passing away, but in comparison to the people that are catching it, is the big deal that's being made out of it, is it warranted? Because, okay, we know people are passing, but look how many people are surviving.
It's definitely different from the flu. It's one of the most infectious things that we've ever seen in our lifetimes. And the way that COVID affects the body is not like anything that we've been taught in medical school or anything that I've seen in my career as a doctor. So, when you think about a chest infection, you think about listening to somebody's chest, and if there's no crackles, they're probably not that unwell. The more crackles or wheeze they have, the more unwell they are. But all the patients that I've seen with COVID, the chest is just silent. I just can't hear anything, and I'm like, is it working? My stethoscope, have I got it on the right way around? There's just no sounds. And that is not something I've seen in my career. People are walking around with really low oxygen levels with COVID, and we don't necessarily see that with other chest infections. So it's a very strange disease, and it's definitely not flu.
When do you think we will know, have a hold on it? As in, we'll know, okay, this is how we... Because I always say, correct me if I'm wrong, I'm not a doctor and I don't know loads of stuff, but I will say, isn't this kind of what the flu was like when the flu first came? Everyone was panicking, and we didn't know what to do because we'd never seen anything like this before. Is it not that type of thing where we just don't know how to navigate it? So once we get used to it, it'll be normal.
I don't know what it was like before there were flu vaccines, when the flu first came. Not really seen much about that.
Right.
But it's definitely, this pandemic is a serious thing. The whole world was almost shut down at one point in time. That's never happened.
That was wild.
Because of previous flu outbreaks in the modern time. The Spanish influenza was really terrible. That was many years ago. But yeah, it's something that I hope we will never have to see again. Now, we know with pandemics, eventually they will come around, but it's about preparation, and I hope that the whole world is more prepared for pandemics now that we've seen that it is something that can happen. It's not just a myth. Pandemics really exist.
Well, there was reports today that came out that we're going to have another wave, and it could just be as bad. It could be just as bad as the last one. And then you do kind of start thinking to yourself, are we going to have to go through this every winter or every, and do we just, do we not just go on as normal? Do you get what I mean? Because I felt like that at one point. I was just how many times are we going to go back into lockdown? Because obviously this thing's not going anywhere. So then how do we learn to live with it and to be safe? And is it just inevitable that you will catch it, but you just have to make sure you make sure you keep yourself locked away, you protect your family, just learning ways to kind of cope with it instead of we just get shut off from everything. Do you get what I mean?
Lots of good points that you made there. So as we're approaching winter, we need to be adaptable. So that means that we need to see what happens. And if we get to a level where infection rates are really, really, really high, and at the moment they are climbing in this country, especially more so compared to other European countries, if it gets to the point where hospital admissions are overwhelming the NHS, then a decision will have to be made, because it's not right that, you know, if someone calls an ambulance, there's no ambulance to come because they're all outside the hospital because there's no beds. It's not right that people who have other medical conditions like heart attacks, strokes, car accidents, fractures, I mean, there's so many different things, sepsis, these people all need treatment, as do people who've got cancer. If hospitals are becoming overwhelmed, we will need to sort of reevaluate things. At the moment, we know that the vaccine program is protecting against the high numbers of hospital admissions that we saw last year. So it's not at that high level, but it is still climbing slowly. So we've just got to see what happens. No one can exactly predict the future.
And by doing that, we just have to keep doing the stuff that has been put in place, like washing your hands and isolating yourself. What about if you live with people and one person catches COVID? How do you kind of contain it? Do you get it?
Yeah. So the good news is that for people who are double vaccinated, they don't actually have to self-isolate.
This is the thing that really blows my mind. Okay, so if I'm double vaccinated and I'm in contact with somebody that has COVID, I test negative, I can go about my business. If I'm not, then I have to isolate for 10 days. But we know that people that are double vax can still give somebody else COVID. So tell me how this works. Because if the vaccine is supposed to protect everybody and make us all safe, then why is it that they are allowed to go out, even though they still could be carrying it, but it's not showing up yet? Because the whole point why I have to stay in is because it could show up, but it's not showing up yet. So that's the same with the vaccinated person. So why, what is that about?
So if someone's not vaccinated, the chances that they're going to catch COVID is so much higher than if somebody is vaccinated. And because we have vaccinated a vast number of people, you know, there has to be benefits to being vaccinated. We know that it protects against COVID, and we want to keep schools open, hospitals open, supermarket open. You know, we do need to keep the country moving. The good thing is that, you know, you can have a test, make sure you're negative, and if you do develop symptoms, then, you know, obviously that's a different scenario, and the person who has COVID should be isolating themselves from the rest of the household. Right. Okay. So that's why that's in place.
Okay, and if the people that are not vaccinated and they're in that household, do we stay in the same? Do we separate the rooms? Does everyone still stay to their rooms? Or
it is best that the person who has the infection tries to stay away from other people in the household, because it's highly infectious, and we want to reduce the risk of other people from getting it. Obviously, people who need carers, or, you know, young children who need people to look after them, it's different. But, you know, having good ventilation is important, washing hands, etc. is all important.
What would you say to the people that are still skeptical about COVID? And I still hear those things online, and you know, people putting up whatever they want to put up. And what would you say to those people that are just a bit like, still?
Yeah, I mean, I don't understand why people who are skeptical are so keen to influence everybody else and affect everybody else's health decisions. As we've discussed today, it's an individual choice, right? And we're sharing the facts so that people can make their own choice. We're not trying to bully people to believe what we think. We're just sharing facts. And so I think that people who are, who have different ideas, they have a responsibility to really evaluate what it is that they're sharing, because it can be quite dangerous.
And again, just going back to the Black community, I know there's so much pushback when it comes to the vaccine, even COVID in general, and I think that just comes from our relationship with the NHS historically. You know, we don't believe all that, you know, sometimes people, you know, Black people have been used as guinea pigs before when it comes to these type of vaccines, etc. What would you say to that, to those people as well?
Yeah, What I would say is that recently I've been looking so much into health disparities, especially between black people as opposed to white people, as opposed to Asian people. And, you know, there are health inequalities in various different conditions, not just with COVID. So I completely understand why black people may be skeptical when it comes to healthcare providers and what's in their best interests. The good thing is that I feel like the NHS and I feel like the government are really listening to the people who've been shouting. There's a lot of health professionals, not just black health professionals, but a lot of people who are trying to be our advocates now and really trying to make sure that we achieve health equity. So that is not just giving everybody the same thing. It means giving people what they need as an individual, and that might be because their race might affect their outcome, or where they live in the country, or their socioeconomic status may affect their outcome. It means giving people what they need to achieve the best health outcomes.
I think, like, I'm quite a logical person, so I feel like I've been on both sides of like, I don't know if this is, and then I've been like, do you know what, I've had people around me affected by it. So I definitely am not one of these people like, no, I don't believe it's real. Yeah. I do believe it's 100% real, and I do believe that the effects it has on different people are 110% real. I just think that there's just that mistrust, I think it is, with something new. And I think that's just in life in general. Like anything you're not familiar with or you don't know, you're going to be a bit like, whoa, what's happening here? Yeah. And I think that's what's happening at the moment. But I do feel like there's a shift happening, because I remember at the beginning, everyone was so anti, the vaccine. And now I know people are just like, yeah, man, I went to get my vaccine the other day. And like, you almost just talk about it all the time. And that's one thing that I do find weird, though, that everyone just talks about their status. Just like, yeah, I got mine done. Like, I went there the other day. And it's just like, to me, it's become a thing where I feel like it should be, we've been saying, it's your own personal decision, however you feel. Don't let anyone bully you into not doing it or to doing it. And I think as well, as much as the doing it, it's also the not doing it, but especially within our community, in the black community. You say in the beginning, when you said if you had it, people looking at you sideways like, what, you let them do that to you now? And I think either way, don't let people tell you what to do. You decide what is best. But I do see that there's a shift slowly happening, and I think that is for the best, because I think with the shift happening, people are becoming more responsible. But because we're kind of living it with now, on the other hand, I do see people just not caring anymore, and I get a bit worried, like, what's the perfect balance?
The balance,
yeah. What's the perfect balance?
So, I mean, the vaccine isn't completely new now, so it's almost been a year since we started vaccinating people, and some people have had 3 vaccines. I've had my booster, and I'm so happy.
So talk to me quickly about the booster. Yeah. Talk to me about that.
So some people will be offered a booster vaccine. So these may be people who are elderly, or people who have a reduced immune system, or healthcare workers like myself, where like my last vaccine was more than 6 months ago, because we know that immunity levels begin to reduce sometime after the vaccine. So to keep me safe when I'm going around and at work, I've had a booster to kind of boost my levels. And I have to admit, when I saw numbers going up a little bit and I hadn't had my booster, I did feel a bit more nervous.
Right, okay.
And when I got it, I felt like, yeah, I'm good to go again. And in terms of people talking about vaccination status, in my place of work, when people were first getting vaccinated, it was kind of a little bit of a taboo subject, so you didn't want to like ask somebody in case they felt like you were pressurizing them, and we weren't really talking about it so openly. But now that we see that the vast majority of people have been vaccinated, we're a lot more open about it. And for example, with the booster vaccines, it's just kind of like coffee chat, like, oh, have you had yours? Oh, you haven't? Oh, I'll cover you this afternoon so you can go to the clinic and get vaccinated. Like, we're really trying to take care of each other, and it's more like a positive thing than seen as a negative thing.
So final words, all of us, but the young people, because we go out a lot and we are, active, we in these streets, honey. What's the top things that we can do to keep ourselves safe, our family, our friends, but also live life as well? Because we don't want to be stuck in the house. We don't want to. do we get the perfect balance?
So information is power, and a lot of people don't actually know where to get the information it is that they need. So if people just remember the NHS COVID-19 website has everything that they need, they're good to go. So it has information on how to book your vaccine online, who will be invited for a vaccine and when, and there's more information about what type of vaccines you'll be offered. There's information about when to take a test, when to isolate, tells you about the lateral flow test, tells you about the PCR tests, and it's important for people to know this winter that if they have symptoms of COVID-19, so fever, cough or loss of smell or taste, to get the PCR test, the one that you go to like a drive-in centre and they do it. It's not the lateral flow test. The lateral flow tests are there just for monitoring for people who don't have symptoms, to make sure that they don't have COVID. And also if you go to the website, it tells you about the number that everyone should remember, which is 119. So on that number, you can book your COVID vaccine, you can ask them about testing. If you're not sure about isolation, they can give advice as well, although the test and trace system will probably contact people and let them know if they need to isolate or not. I'm on a roll here.
No.
The app is really good. So I have the NHS app, which is not the same as the test and trace app, which is also a very good thing to have. But it basically just links to my GP surgery so that I have my vaccine status on there. So if I'm going somewhere, if I'm traveling, I just download a PDF that has like a code and then I can use it. So that's a very good thing to have. And, you know, just being mindful of, you know, this is a disease that is spread by touch, and also it can be spread in the air. So keeping outside as much as possible, good ventilation wherever you are, washing your hands and wearing masks in crowded areas. So we've spoken about information, we've spoken about washing hands, we've spoken about testing. Oh, very important thing. It's important to take care of yourself, okay? Healthy food, lots of vegetables, not drinking too much alcohol, guys, when you're off to uni, okay? Avoiding smoking, making sure you're getting enough sleep. All of these things work towards a healthy body, and our immune systems, at the end of the day, is the thing that, you know, will fight this virus if we get it.
Okay. Well, we probably could go on for loads more, but I feel like don't want to give too much information. I feel like the information that we've given is the information that is needed for people to be able to live, like you were saying, a COVID safe life. So thank you so much, guys. I'll put all the links and stuff in the description box, so you know all the websites that Dr. Gabi was talking about. And are you on socials, on Insta? People can message. Can they, if they've got questions for you and following up questions, because I'm pretty sure they will have. Where can they contact you? So
people can find me on Twitter and also on Instagram. My handle is Dr. Gabi Official. That's DR GABI Official, and you're more than welcome to follow me. I talk about this stuff all the time, and I talk about holistic healthcare, inflammation, health inequalities, and people can send me questions as well, although I can't give individual advice. I can give sort of general tips.
Okay guys, so you know what to do. Like, subscribe, and make sure you share this one with your friends and your family. I know we all want to live our best lives, but also we need to be safe, and this thing is very much out there, so let's all be responsible. See you later. Bye.